Good day, everyone. My name is Matthew Ocheleka Itodo. I welcome you to this online tutorial. The topic before is titratable acidity in urine. I will say, as a point of introduction, that titratable acidity of urine can be defined as the amount of acid eliminated per liters of urine. So, if an individual can pass out a urine up to 1 liter, if you are to check what is the amount of acid that is present in that urine, is the amount that is eliminated per 1 liters of that urine from the particular patient. To move ahead, we say that this titratable acidity of urine can be defined as the amount of acid eliminated per liters of urine. And when dealing with urine, it is more physiologically meaningful to consider titratable acidity, because this titratable acidity, since the urine is coming out of the body, means it has something to do with the normal physiological condition of the body, which is the body pH of 7.4. And then to move ahead to explain better, we say that this titratable acidity is the amount of alkaline required to adjust the pH level of urine back to the pH level of original blood plasma. The original blood plasma, which is 7.4 in every mammalia species, if the titratable acidity is higher than this 7.4 in mammalia species, what amount of base that will be required to adjust the pH of that original blood plasma of 7.4 we refer to as titratable acidity. Listen carefully as we proceed. If titratable acidity is defined as the amount of alkali required to bring an acidic urine to pH of 7.4, then what will you be talking about titratable alkalinity? Means it will be reversed. It's just like an opposite. If titratable acidity is the amount of alkali required to bring an acidic urine to 7.4, that means titratable alkalinity will be the amount of acid required to bring an alkaline urine to 7.4. So it is opposite of each other. So the real urine tends to be more alkaline on standing because of breaking down of urea to ammonia. And in a practical class, you have been heard or you are told that if urine is to stay for a while after it has been eliminated out of the body, the urine that had been an acidic before will convert itself and become an alkaline. And so if you are to check it using a laboratory procedure, you'll be able to get an accurate result because the urine has been converted from acid to a base. But there are ways we can play around that in a practical class. Now listen carefully now. There are ways that we can use formalin. We said that formalin tends to become acidic on standing for a very long period of time because of the breakdown of formaldehyde to formic acid. That is to show that formalin has a capacity on its own to stay for a very long period of time by breaking down of itself from formaldehyde to formic acid. So that is to show that the formalin may be neutralized on the day of the class by adding phenolphthalein or titration with sodium hydroxide to a permanent P color. That means for you to be able to use a urine that will be standing for 2 weeks during practical, means there's a risk that urine need to be added with formalin, so that the potential of that formalin to stay for a very long time also keep the urine to stay to maintain its acidic content for a very long period of time. And then in that practical, also remember that before you started titrating, to have an accurate result, don't forget to add phenolphthalein and then titrate with sodium hydroxide until you have a pink color, in order to neutralize the ability of the formalin from the urine to have an accurate result. That is why it is necessary you add phenolphthalein. Now we continue. Listen carefully. We said the pH of the neutralized urine from the first titration and the neutralized formalin would then be the same. Now listen carefully now. Now the pH of urine. You use it to compare with the pH of the urine, the one that have been neutralized with formalin, to check if it will be the same. If it is different, means the formalin has not done its job. Because the essence of the formalin is to make the urine to maintain its acidic level for a very long time without not being converting to base. That is what is the essence of using formalin in this practical, when you are titrating acidity in urine. So, and in any, if there is a change in pH, it will be solely because of the release of hydrogen ion from ammonium during the reaction. So, the pH have to be the same. There will not be a change in pH. But if there is, means ammonium have released a hydrogen ion at the cause of the reaction. We are moving forward. Now, explaining better what you have to expect if you are to carry out this research in the lab, or if a patient, if you are to check the level of the pH of the urine of a patient, these are the things you have to have in mind as a guide. Phenolphthalein is the most commonly used indicator, turning from colorless to red at a pH value above 8.3. That is for you to have a color change, the pH will be above 8.3. For you to have a color change using phenolphthalein, turning from colorless to red of a urine, the pH must be above 8.3. So, and under careful titration, allow a peak endpoint to be detected around the pH of 8.5. Listen carefully now. Now, what will make you to know that the level you are now, it is moving towards alkaline or moving towards acidic, is the pH. Now, having established that, now we say, if you are using phenolphthalein as an indicator of a urine, for you to experience a color change, turning from colorless to red, your pH must be between above 8.3. But if for you to see another further color change from colorless to red and from red to pink, the pH will be around 8.5. And you know 8.5 is higher than 8.3. So the color change cannot be the same, because the higher you go with the pH, the more the colors will change. And this results in a small systematic overestimation of titratable acidities. So, in making us to understand, we are going further. And then we say that there is a practical study. There is a practical study that has been carried out before. And the essence of this practical study is that, will what a man eat contribute to a pH level of the body system? Now let's see if what a man will eat will contribute. Now let's check this practical study that has been carried out before. Now there is a practical study that compared the urine of a ruminant animal and non-ruminant animal. You all know that ruminant animal are the animal that chew their cud. They have 4-chamber stomach. While non-ruminant animal are the animal that have a single stomach. And we can even call them monogastric animals. And then the example of ruminant animal we can call cow is an example of ruminant animals. And then goat is an example of ruminant animal. Any animal that have 4-chamber stomach. And then the good example that you can remember is that how many animals do chew their core even late in the night? They still have regurgitation of food out of their stomach to chew it back. This is an example of a good ruminant animal. And the non-ruminant animal, human being, is an example of non-ruminant animal. And then they say taking a sheep and a dog as a good example. The sheep is a ruminant animal, while the dog is an example of non-ruminant animal. Means dog have the same system with human being. So the ruminant animal is normally in the state of alkalosis, whereas the non-ruminant animal is a state of acidosis. So at the end of this research, comparing the ruminant animal, which is sheep, with that of a goat, to check their pH level, they come to discover that permanently the ruminant animal, which is the sheep, the goat and the cow, is at the state of alkalosis, means the pH is always high. While the non-ruminant, which can be dog or a human being, is normally at the state of acidosis, means the pH is low. And then how does this apply to you? That is to show that ruminant animal, they eat mostly plant. what we can call a green vegetables in our surroundings, and that is their major food for consumptions. And so because there's a lot of roughage in their systems, any other thing they're eating, the body is able to digest. So how can acid be built when the body is constantly doing its work normally and the pH level is normal? And so, and because it was a constant way of feeding of their lifestyle, the body tend to move towards a high pH of alkalosis. So that is why that systems of the human body for ruminant animal is different from that of a human being. Whereas a human being, example, a dog that is eating meat, eating another form of meat, and meat is high in pH, eating other kind of food like human being, there is no way that your system can be as the same as the system of a goat. That's why your acidic content of a human being is very low, and is at a state of acidosis. So comparing the analysis of different samples from ether species can highlight the effect of diet or on a disease. So when you compare this narrow down to their diet, and then also narrow down to the disease that they can experience because of the animal metabolisms. So the metabolisms then decide whether the pH will be high or the pH will be low. So the component commonly found in urine, they are 1. Chloride, inorganic phosphorus, urea, creatinine, uric acid, sodium and potassium, which are determined with a flame photometer. So for you to be able to see how all this is able to come in urine, you have to use a special machine that we refer to as what? Flame photometer. Flame photometer, if you are to use flame photometer to check this, they are going to have different wavelength if you are to see it. So you will be able to decide that this one is a urine, it's a chloride. In this urine there's a chloride, there's inorganic phosphorus, urea, creatinine, and the rest. And so subsequently we believe that when we have opportunity to have a flame photometer, we are going to see this practically, how it will operate. And this leads us to a practical study that will reinforce the information you gain from this lecture on the role of kidney in acid-base balance. So now listen carefully, and there's something I want to explain to you. I know you have all heard of acid-base balance before, and then for you to understand the acid-base balance means we all heard about buffer before. The buffer resists slight changes to pH, either addition of acid or addition of a base, in order to maintain the body in balance with the pH level of 7.4. So how does this happen? In the case where the body is made up of acid, the pH is very low. What will happen? Hydrogen ion need to be released out of the body, and CO2 need to be released out of the body. When hydrogen ion is released through the kidney, CO2, which is acid, is also released through the lungs. Then if the body is moving towards the pH very high, the body is moving to alkali, that means the base need to be released through what? The kidney. That is what we mean by the role of kidney in acid-base balance. So whatever the reaction that the body proceeds, there is kidney and the lungs that will have the work to balance the reaction properly. We are proceeding, and then to make you to understand further, what do we bother ourselves about this course? Why do we bother ourselves about this course? And so we narrow it down to clinical significance of titratable acidity. What is the clinical significance of this that we are talking about? We all know that disease is associated with a range of acidity. Means the disease that we have a range of acidity that the things operate. There is a pH that favors some particular type of disease. There are some diseases that thrive in some pH, and in other pH it is not thrive. Now, there is an evidence to indicate that this acid level precedes the development of disease, just as death persists after the cure. What happens is that we have been hearing, and we all thought that it is disease that rise the pH. No, it is wrong. It's not disease that raises pH. Rather, the pH is high, and because it is not maintained, that lead to disease. So pH, high pH is high pH that expose a body to a disease condition, not a disease condition causing high pH. we are on clinical significance of titratable acidity. And what we were talking before was that we believed before that it is disease that lead to high acidity in the body. It is not so. Rather, today we are establishing it that there is high acidity before that expose individual to a disease condition. And the reason being that a research has been done and has been carried out that if a disease condition has been treated, but the body still suffers from high acidity, until the high acidity is handled and the body is maintained to a pH physiological normal health of 7.4, it will reverse the disease conditions. And making us understand this better, I will be mentioning some few things about clinical significance to explain this better. Now, looking at the case of a hyperacidity that can lead to duodenal ulcer, that when the amount of acid in the body producing is very high, the acidic content of the stomach is very high, duodenal ulcer tried, it survived in such environment because it was very, very high, until the pH level can be maintained to normal physiological pH of 7.4. And we can also consider achlorhydria. These achlorhydrias can also result to pernicious anemia and cancer of the stomach. Pernicious anemia and cancer of the stomach. Now, what we mean by this achlorhydria is a condition in which the stomach does not produce hydrochloric acid. Means ordinarily the body needs to be secreting and producing hydrochloric acid. But in a disease condition where the body is no longer able to produce its own hydrochloric acid, is what we refer to as achlorhydria. And in such a condition, it will result to pernicious anemia or cancer of the stomach. That is to show that now there's no acidic content at all. Everything in the body now is basic. There's no acid. It means disease condition will flourish. Disease condition will flourish. There will be more. The stomach will be exposed to microorganism invasions, and it will lead to what? Cancer of the stomach. And one of the components of this achlorhydria is gastric acid or stomach acid. So, anytime you hear achlorhydria, we are talking about stomach acid or gastric acid. It's an acid of the stomach. So, hydrochloric acid play an integral role in the digestion of food and protect the body from pathogens and ingestion of food and water. So, when there's hydrochloric acid in the body, the role of the hydrochloric acid, why the stomach needs hydrochloric acid, one of the roles is for digestion of food. And when the food, even has played the role in digestion of food, it also helps to protect the body from pathogens. Now we look at high acid value. When there's high acid value, what happens? The presence of high acid value in old age may be considered as an index to longevity. Means when there's high acid value, there's clinical significance. It's also the clinical significance, if they to be important at all, it go with age. Like the old age people that are old in age, it is good that their body should be able to have high acid value. It will help them to live very long. And evidence presented that in older patients under observation for comparatively long period, there is a tendency to diminutions or loss of gastric acidity. Means if an older person if the older person who is a patient for a very long time, there will be loss of gastric acidity. And it is an indication of approaching old age, that as the man is growing old, at that period, it is normal for him to begin to lose this stomach acid. And so, if it happened and it succeeded that he started losing the stomach acid, it will result to loss of hair and teeth at that old age. So, it means the body can try all possible ways to maintain high acid value so that it can live long and remain in health. And we say that diminution of this activity of this internal secretion, whether this gastric acid or stomach acid, whether it is diminished or it is not secreted at all, it can also give rise to atherosclerosis. Atherosclerosis is a plague at the blood vessel. This plague at the blood vessel, it will give rise for the thing to result because the body is not able to do its normal functions. So on the other hand, high gastric acidity persists into old age, it may be considered as indication of longevity. So what are we saying? High acid value favor old age people. To live long when you are close to old age, the body pH should be maintained, moving towards the region of low that can favor high acid in the body. And looking at this, we will be explaining to you application of titratable acidity. What is the application? We are talking about clinical significance, importance of titratable acidity. Then what is the application? The application is we can use it for diagnostic and prognostic prediction of disease. We all know that in diagnosis, you want to use some certain parameter to know the reason for the causes of the disease. But prognosis, prediction of disease means if the disease is not handled, if it is not treated, on what direction will the disease result to if it is not handled. So this titratable acidity will help the clinical personnel for diagnosis and prognosis prediction of disease. And then number 2 application is what? Prediction of food acidity. And one of the ways to experience this food acidity, titratable acidity. So if the food have a high acid content and the individuals who have a high acid content in the body, if you are feeding on such food, the high acid content will reduce. If it is not high acid content, is not favorable to you, just like a young age, as we are talking about, means you should go for food that will not have the high acid content, or food that tend to move towards the alkaline, so that the high acid content will be balanced by eating the food tend to move towards alkaline to have a normal pH of 7.4. Having said all this, we have this topic to an end. Listen over again as you understand better. Thank you.